reason I'm very distressed by what I've seen over the last several days is here's a message that don't worry about it. Look at me. I got it. I'm fine. That's what we're hearing. Don't let it bother you, downplaying it. I don't know who all listens to your show, Clay, but I would guess very few of us have access to a team of doctors, a little mini ICU in our house, a helicopter to take us to the hospital where we have our own with many, many more doctors, and where any kind of medicine that anybody thinks will help us, that medicine is made available to us. If you have someone else that's on your show that has all of those resources, then that's the only person that could listen to this guy saying, don't worry about it. It's just a horrible message.
Yeah, I mean, and there are folks out there who are falling for this. I mean, you don't have what he has access to. He is
No.
incredibly privileged. He is incredibly privileged. You don't have any of that, what he has access to. So it really appears that he's doing some serious, serious damage. Does it make the work for someone like you? Does it make it harder when you have the president out there doing this?
It makes it much harder. I was the health officer in charge of the public health response when we had anthrax. I was on the governor's advisory committee in Maryland when we had H1N1. So I understand what it's like to be the public health person on the front line. I understand what it's like to be advising the politically elected leader who has to make decisions. And everything that we're seeing from this particular White House around this virus makes it harder. Look at all of the public health people around the country, and I know some of them who have lost their jobs because they didn't agree with a political decision about how we're going to approach this. So much of what we've seen over the last many, many months has been completely not based in good health practices because what the major part of this message, especially over the last several days, what about the African American community, the Latino community, Latinx, all of these communities of that have way higher death rates, that have way higher illness rates, that have way lower resources, and they're not getting any sort of a message, particularly other than what you're doing. Thank you. Other than this, let them know, hey, wait a minute. We haven't forgotten about you guys. We haven't forgotten about all of the people that you're losing. And I appreciate Joe Biden talking about the empty seats at the dinner table and that kind of thing, because that helps us to refocus on we're not that guy. We're not that guy in the White House. We don't have access to what he has access to. And if we keep listening to him and we keep pretending that he's not speaking for us and he's not even speaking to us. It's really distressing. Yes, the simple answer to your question is, does it make it harder for public health folks? Yes, it does.
Now, do you think he's in the clear? Do you think that it's all done and he's safe and there's nothing to worry about? Is he in the clear?
No, I think he's rolling a very large paradise. I think that the potential is that he could be, but no one knows. And if you talk to anyone who is an actual health or infectious disease or doctor type person, they will tell you that you can't actually know this soon. And certainly when you're pumping folks full of all of these different kinds of medications, they will mask to a certain extent how sick someone really is. And then the things that we use to kind of look at what's happening with your lungs, because we know coronavirus, COVID-19 really does go after lungs in addition to other body. We don't know what those scans look like. We've heard that everything is fine. We've heard that there were normal changes, whatever those are. So no, I don't think he's out of the woods. Would I be surprised if he doesn't get any sicker? Would I be surprised if they say that it's been 10 days now and he's fine? Would I be surprised by that? No, I wouldn't be, because we've learned so much over the last several months. And the resources, I keep going back to that, the resources this guy has access to and his family they have access to, we have to make sure we continue to focus on that and not take anything from his care that may relate to how we should behave and how we should handle ourselves if we get if we test positive.
Dr. Walks, I believe, do I have this correct? Were you involved with Ebola? Did you do any work around that? Do I have that accurate?
I was a consultant with Ebola. I did not actually do any work on Ebola.
Okay, I'm curious to know from an international perspective, from a global perspective. I know the guy in Brazil is pretty crazy as well, and Boris Johnson over there in the UK is crazy. But from an international perspective, a country like the United States, have you ever seen this kind of performance, if you will, from world leaders outside of the two that I mentioned, especially countries maybe in West Africa that may have been hit really hard with particular diseases? Have you ever seen this kind of performance?
Well, let me say that there have been different levels of, to use your word, crazy, but there have been different levels of people being dishonest, disingenuous, all of that in different parts of the world. What I look at now is I look at how other parts of the world are looking at the United States when our death rate per million is way above everyone else's. And I mean, way above everyone else's. We're above everybody, Canada, the UK, whoever you want to look at. And then we have somebody who completely ignores that and says, oh, no, we're doing great. I'm giving myself an A+ on how we're handling this. We have a particularly dangerous kind of leadership in our country right now. And it does make you think about, wow, this must be someplace else. This can't be America, where it's sort of the don't believe your lying eyes. Don't look at all of the graphs that show what's happening in America. Don't look at what's happening in your community. People of color, people that are from diverse backgrounds. We're going to just pretend that there is no difference for you. All you have to do is just listen to me and you'll be fine. It's wrong. It's absolutely the only correct word for it. It's wrong. We should not do that. We should not talk to people who are looking for leadership, who are concerned, lost family members, and say to them, oh, look at me, I'm fine. It's wrong.
So where do you think, I spoke to you in March and you kind of predicted we would be where we are right now. You were pretty accurate. I mean, you were saying as far as where the numbers would go, and you said there would be a resurgence in the fall, a second wave, if you will, and we're seeing that happen all over New York, sadly. Where do you think we will be with this coronavirus if Trump is still elected, if Trump is reelected rather, and where do you think we'll be if Joe Biden is reelected? What would be the difference? Not reelected if Biden becomes president, forgive me.
Right. No, I understand. I look at places where there have been two factors. One is a leadership factor. I think leadership matters. I really believe leadership matters at all levels. And I look at the cultural factor. And I think we have to be concerned about both of those. We have such a divide in our culture here in America where people are completely believing this is true and other folks are completely believing this is true, right? So to your question, I think that if Donald Trump is reelected, and I just shudder to think about it, because this is not the only public health crisis that we are going to deal with. It's not the only crisis that we're dealing with. We're dealing with all of the social injustice issues, and you turn on the news for a moment and it's difficult to watch a lot. It's difficult to talk about. And our mental health is another part of public health that is challenged by what we're seeing. And I think we will see more of that. I think we will not get people to do the simple things that could make a huge difference. The wearing the mask, the washing hands, the keeping the distance, all of those things that we everybody can recite it, but not everybody is doing it. I think if we have a change in leadership at the national level, and we have someone who consistently gives that message, not just whatever the scientists say is fine. That's not the message. The message is, I'm listening to the scientists. I'm using my own experience as a leader for many, many years in this country. And here is the policy I want to put forward. It's based in science, it's informed by science, but it's coming from leadership that we know, that we elected, that we trust. That's what's missing now. And so I think that if we do have a change in leadership and Joe Biden and Kamala Harris are elected, I think we will get that sort of clear pathway. Well, where are you getting that? Where's that coming from? Oh, well, let me explain to you where it's coming from. I've met with this doctor, that doctor. I remember working with Dr. Fauci years ago when I worked in Washington, D.C. And that sort of clear, scientifically based, you can take it to the bank kind of scientific rigor, informed by just caring. I am very distressed by the lack of caring for when you see that currently, it makes you long for someone like Joe Biden who's able to talk to people directly, who's able to say, I do care about you and I'm giving you advice that you can depend on.
What do you say to people, because this did happen? Originally, Dr. Fauci said a mask wasn't effective. And then later on, he said, okay, the mask is effective. What do you say to people who are frustrated that that it changed from March to about, I guess, April or May?
Oh, that for me, the answer to that is clear. We know more today than we did yesterday. We knew more in April than we knew in March. And so when you're looking at the information that you have and it's incomplete, you can't just say, well, I don't know anything and I'm going to wait until I get all the information. You can't do that. So you make your best decision on the information that you have. I remember my mom told me years ago, if you honestly tell people when you don't know, they'll believe you when you come back and tell them what you do know. There's something about honesty and credibility that matters. So the response would be, what I told you in March was based on what I knew in March. And now I know more. Now there's more science. Now there are more results. This is April. We know something different. That's how you handle things like that. Of course you can't. No one has a crystal ball and you can't predict the future and things are going to change. And I have a lot of respect for people who are willing to come back and say, I did my best last week. I know more. I can do better this week. Stay with me. Let's work together. That's how you handle things like that.
Yeah, and that's what he did. I tell people, I mean, you're not going to, that's what science is. You figure these things out when you know more information. You tell people.